and done with support from the American Occupational Therapy Association, the American Physical Therapy Association, together with the National Council on Aging. And I'm not sure why this is going on by itself. But many of us want to know, are falls preventable? The simple words, he or she fell, are a huge impact on us. We all know someone who has had a fall and has experienced significant changes as a result of that. But are falls preventable? Yes, the good news is, yes, they are, with simple measures sometimes. Though they are experienced by many older adults, managing falls is a normal part of aging. And I'm not sure, I think I might have put it on, there we go, on aging. And falls themselves are not a normal part of aging, but managing them is. And what I hope that you all will get by the end of this presentation is some ideas for either yourself, your family, or your friends that you can address this important issue. So today we're going to talk about some Utah resources for fall prevention, so specific to our area, what a fall is, the definition of a fall, why fear of falling is important to address, what are the risks for falling, and what action steps you can do to reduce your particular fall risk. As we go along with this, I'm going to ask you to kind of think of some things in your particular situation. The first thing that I wanted to share is this Living Well at utah.gov website. It has some great workshops, it has some information, and not just about, you see that the falls prevention is on the left in the middle, but they have lots of great information about everything else. I use this as a resource all the time. And again, I just wanted to highlight that. By clicking on fall prevention, you can explore different workshops, and there's a particular few that I want to kind of draw your attention to: the Otago exercise program, stepping on, the Tai Chi for arthritis, and the walk with ease. And again, if you click on any of those, it gives you more information about them, but these are the ones that I would highly recommend, and they have been proven to prevent falls. So what is a fall exactly? I'd like to actually make sure that we all have the same language. Landing on the ground or some lower surface when you didn't intend to fall is a fall. So that includes trips or slips, but accidents that cause you to fall, like if somebody runs a supermarket cart into you, those are not considered falls. But for example, you do not have to land on the ground in order to have fallen. If you try to get up from a chair and then you fall back in, that is actually considered a fall. The same, like, or maybe getting off the toilet or something like that. So as we go through the risk factors for falls, I want you to think about what might have been the cause of recent falls, either for you or for somebody you know, or just to kind of have like an inner dialogue about this. So for example, have you had a fall in the past year? If you did you tell your primary or your health provider? Were you hurt? Do you worry about falling? Do you feel steady when you're standing or walking? Any kind of fall increases your risk for another fall. So this is something really important for us to realize. I might have just kind of like staggered, when I got on the first step going down to the basement, but that could turn into a bad fall later on. So this is what as I talk about things, I'd like for you to kind of in the back of your mind think, oh, did I do this? How would I deal with this? When asked, are you afraid of falling? Many people say, oh, no, I'm not afraid. I'm just being super careful. But stopping from doing activities because of fear of falling creates a lot more problems. And it also increases future fall risk. This is something that has been demonstrated, and we see this all the time. I work, like Paige mentioned, at Intermountain Medical Center, and we see this all the time. People end up not walking as much because they're afraid, and then their legs get weaker, and it becomes this circle. So, and again, why does the fear of falling matter? Because it can stop you from doing your favorite activities, be it, taking your dog for a walk, meeting with friends for dinner. So legs will weaken with an activity, and that itself leads to falls. Not getting out in the community might make the person feel alone. It may cause depressions. And again, the activities that are socially active, this is such an important part of us continuing to remain healthy in our age. And I can talk, I'm in my early 50s, and I see this already, how sometimes I try not to do things if I'm afraid some bad outcome is going to happen. So there are three main types of risk factors, and we will talk about each one independently. Most falls experienced by older adults don't happen just because of one of these risk factors. It's an interaction of the different ones. So the first one that I want to highlight are the physical risk factors, changes in your body that increase your risk for falls. For example, if you're inactive and your legs become weak. A behavior risk factors are things that we do or don't do that increase our fall risk. For example, taking greater risk, like climbing a ladder to remove leaves from the roof, or taking the Christmas lights off when you're 82 and you think, I can do it. Environmental risk factors are hazards in our home and community, like porch steps without railing, a toilet that is too low, or a tub without grab bars. And I'll talk about each one of these independently, and I'll try to give you some ideas how we can address these. So each one of us has different risk factors. Some we can change and some we cannot. My challenge to you is if we could work on the ones that we can change, things like physical inactivity, home environment, vision, medication use, the fear of falling, and understanding that the social isolation, particularly in view of this pandemic that we all have been dealing with, weakness or improper use of devices. If you're using a cane just to carrying around, or a walker just to lift it up, that actually itself can lead into a fall. There's certain things that we can change: our age, our gender, our ethnic background, which puts us at higher risk. So those, because there's some that we can change, I think we really should focus on what we can. So falls, what can you do really to prevent them? The Centers for Disease Control has this great little, and I know it's gotten a bad, lately the CDC has gotten a bad name, but they do some real good work in terms of prevention. And they have this very nice pamphlet, and it kind of looks at your risk factors. It gives you like a checklist of things. And if you're interested, I can send this, I can email a brochure to all of you, or I can email it to Paige and she can just distribute it. The four main things that we tend to kind of focus is exercise to improve your balance and strength, have your doctor or pharmacist review your medicine, have your vision checked. This is a huge, huge thing, and make your home safer. And I'll particularly address number 1 and number 4, because that's kind of like, as an occupational therapist, this is something that I kind of address. But again, I'd like for you to be aware of the rest. So some general exercise recommendation, always, always, always talk to a doctor before starting an exercise program. Yes, I am Dr. Mueller-Planitz, but I have a doctorate in education and occupational therapy. You need to talk to a physician or your healthcare provider. You can begin with a fall prevention class, and again, I'll give you some more resources, or you can work with physical or occupational therapy. Just make sure that when you start an exercise program, that the classes are up to for your age group or ability level. When you find something that you enjoy, stick with it. My dad was visiting me from Florida. He's almost 89, and he really enjoyed the Zumba class. And I don't usually go to it, but this is what worked for him. And it's at the rec center close to where I live. And he just got the most joy out of it. And he made friends, and it was like his way of doing things. And again, exercise is something that if you can find something that you like and you enjoy, you will continue doing it. If you feel that you have to keep up with your neighbor who does yoga or lift weights, and this is something that you don't enjoy, try to find something that works for you. Research has shown that if you like what you're doing, you're going to stick with it. And that's the most important thing about fall prevention and in general about having an exercise program, just having that consistency. Let's see. So there are a lot of information or environmental recommendation that are available for you to address and identify fall hazards in your home and community. And it's not just in the home, it's in the community. So if you are going to Walmart or to Costco and you notice that, there's always a step where there's not enough light or something like that, please flag it to that particular business or flag it even to one of us or, the area of aging, the senior center, we can kind of help with that. Again, there's a safety brochure, the Steady Toolkit that kind of gives you an idea of different things. In this particular toolkit, you can actually find particular ideas for changes in each room. So again, there's so many resources out there, but I'm trying to focus on maybe one or two that are easily available or could be easily available to you. All right, and I'm not sure, this is not, all right. And here's some ideas for home modifications. Keep the stairs and walking areas clean and free of electrical cords, shoes, clothing, books, magazines. I know when I used to do home safety evaluations, I would go into people's homes and they would have all these treasures, which are wonderful to have, but especially on the stairs, this is where we see a lot of the falls that end up in a hospital. So this is particularly important in the stairs and the walking area, for example, between your bed and your bathroom. Make sure that there's nothing in between. A second one is to improve the lighting in and outside your home. I know that I have this struggle with my dad. He feels that there's just too much light and we need to conserve energy and maybe we should turn some of the lights off. And using either a nightlight or a flashlight to light the path between the bedroom and the bathroom is a wonderful thing. It can save you a trip to the hospital. Oftentimes when I see patients in the hospital and I ask them, how did the fall happen? It was either on the way to the bathroom or it was on the stairs. So if you can make sure that you have well-lit areas, particularly in the stairways, and make sure in the stairways that you have light both at the top and at the bottom. We've seen quite a bit of either at the top or at the bottom, there's not enough light and people miss that last step. Having an easy to grip handrail installed along the full set of the stairs. Some of our homes are a little bit older, so we only have the rail going halfway. That helps also with safety. Turn on the lights before using the stairs. I don't know that I can say this enough. Like I said, I've seen too many patients that they said, oh, but I know my house so well, I just didn't turn it on that one time. Well, that one time is what caused them to be in the hospital. And see an eye specialist once a year because that can prevent falls. And we'll discuss this a little bit further on because this is really important. Sometimes it's not the lighting, sometimes it's just the way that your vision changes as we grow older. Another thing that is very helpful using non-slip mats, particularly in the bathtub and on the shower floors. Having grab balls installed on the wall next to the bathtub, the shower, and the toilet. If there is a spillage, wipe it up immediately if you can. These days, for those of you who live maybe in a rented apartment, in the old times, they never allowed us to install grab bars. I really had to advocate for my patients to go to the landlord to ask. But these days, there are grab bars that use suction so they do not damage, that can be done. Again, you might want to reach out to a professional such as an OT or a PT in order to get assistance with that. And lastly, not lastly, but one of the more important things, be aware of uneven surfaces, both indoors and outdoors. Always smooth out wrinkles and folds in the carpet. Be careful with the sidewalks or the pavement outdoors. Even we've had patients actually have falls on the way back from the getting in and out of the car in a parking lot. Ask a family member or a friend to clear the snow or the ice from your driveway, especially if it's a little bit uneven. Always use handrails when available. I think that we get so good about, oh, I'm in familiar area, I don't need to, but this makes a big difference. Another fall risk is medications. Some of us are on more than one, and quite a few of the medications, the side effects may make you dizzy. Talk to your provider, because sometimes you can take certain medications at night and that might be better. They still can help with your blood pressure and cholesterol levels, but they will not interfere as much with your activities. Medication changes can increase fall risk whenever they either up your the amount that you have to take, or maybe you get on a new medication, the way that they interact. Again, this is when it's helpful to talk to your pharmacist and to your primary physicians. Using one pharmacy is great for that. And you can ask for an annual medication review. I understand now that that's being, it's made available twice a year. If you want to have an annual medication review, Medicare pays for it. So please do that, and make sure that you can read your labels. The pharmacies these days, they're required by law to make them a certain amount, but they can also make them bigger if you need to. So just ask for that. And again, talking about being able to read things, vision is a big risk factor with falls. Ask for an annual eye exam after age 50. Because multifocal lenses, they blur or distort when you're looking down. This is a very big fall risk. The optometrists these days are very good about telling you to particularly pay attention to that. I went recently to an eye exam, and I was pleasantly surprised to hear that this is part of their education. When somebody gets bifocals or trifocals, they really try to get this across. They even had me sign that I was told about these things. One thing as we get older, removing cataracts may reduce fall risk. So if you're on the if you're considering that actually helps with fall risk, it's something that we all can really benefit from. Another thing, it's very important to address blood pressure and the fall risk. Quite a few of my patients, quite a few of all of us these days are on blood pressure medications, and it's really important to check that regularly, not, like the once a year when you go and see your doctor. If you get dizzy when you stand up, it's really important for them to do this special test that they look at sit to stand blood pressure. And if you know that this happens to you all the time, mention it to your healthcare provider. There are things that we can address. We can teach you how to particularly do things. There are particular blood pressure meds that increase falls. This is something that doctors always discuss with a patient. But there's always so much to consider. That this is why talking to your doctor, talking to your pharmacist, and particularly mentioning fall risk. I think I've noticed the last couple of times that I've gone with my dad to his doctor's appointments that they are asking about a fall risk every single time when he goes in. Even if it's not just the annual, when he goes in just for something else, they will ask that. And I think it's a wonderful thing. It's making us aware, and I hope that you have the same experience and doing that. Another big problem, or in addition, it's a fall risk, is the chronic conditions. Because things like diabetes, arthritis, stroke, chronic pain, COPD, and sleep disorders, these all increase your risk of falling. And if you know that you have one or even more of these, you need to be super careful and maybe again discuss either with your physician or take some steps to be proactive, and we'll talk a little bit more about what you can do for those. So just as a review, risk of falling may increase also when there's a change in medication. If you have an illness or an infection, I don't even want to tell you about my patients who have had COVID. You know, they not only are weaker, but they have to have oxygen, so they have the cord, and because of that, they can trip or fall. Even something as simple as an UTI can cause you to lose your balance and have a fall. Pain is a big one for increase of fall. Lack of sleep, or lack of good sleep, good quality sleep, you know, waking up every couple of hours. When you're sad and worried, and aren't we all with this pandemic, this is one of the risk factors that can lead to a fall. If you have a change in how you use a cane or a walker, or if you have a brand new one, I put this picture of this very nice walker that you can actually sit on, and the chair actually opens up and you can store some things and you can take it from room to room. But if you forget to put, this has brakes on, so if you see right next to where you hold your hands, you have to put those brakes on. I've had patients say, oh, you know, for Christmas, my family got me this. It's called the Cadillac of wheelchairs because you can sit on it and it's great. And how she fell was she forgot to put the brakes on because she wasn't used to using this kind of a walker. And she ended up having quite a bad fall from it. So again, anytime when you change or you start using a new type of equipment, this is something you want to consider. A move to a new home or a new environment, maybe you're going to St. George to stay with your granddaughter. You know, whenever you are in a new environment or situation, it's a little bit harder, and that's a risk factor. Or it could be that maybe now you're living in an assisted living facility or something like that. Again, be aware during any kind of transitions or changes that may increase your risk of falls. So there are many things to do to prevent a fall. And we always say, try to address only maybe one risk factor first. You know, maybe talk to your pharmacist or your doctors, you know, to review the medication. Maybe talk to an OT to have a home assessment. All of these are usually reimbursed by Medicare and insurance. So if you're able to make one single step. Now, there's even smaller steps that you can take, maybe taking one of the classes, and I'll give you the website again at the end of my presentation, but on Live Well, a lot of these are free. There's some classes that you can do from your own home. Especially these days, you know, you don't have to physically go to a rec center or a senior center. So choose one risk factor and try to address it. Now, what should you do if a fall occurs? This is always a question. I kind of added this slide after I've done this presentation a few times, because this was one question that I always got asked at the end of the presentation. So if a fall occurs, always check for injury, call for help if you think it's needed. Please seek medical attention right away if you think you might have hit your head. When we fall and we hit our head, you don't have to bleed on the outside, but you can get a hematoma there could be bleeding on the inside, and that could lead to major problems later on. So even if you don't go to the hospital, call your doctor and let them know that you fall, or call your healthcare provider. Check for safety hazards, kind of figure out, how did that happen? Was it because I slipped in the kitchen as I tried to reach for something? Was it because I was too tired and I didn't turn the light on in the middle of the night when I went to the bathroom? Was it that I missed that last step because I didn't turn the light on when I took my laundry down? So again, kind of have a check for hazards, and learn how to get up safely from your either OT or PT. There are a couple of great YouTube videos for this. I used to teach therapists, students to be therapists, and they're just great YouTube that are fun YouTube videos on how to safely get up. All right. So I wanted to kind of like switch gears a little bit and give you some resources and ideas how to prevent falls. And evidence-based means that there is research that shows that these programs are effective in preventing falls. So this is not just that, it's a good idea. This is evidence. People that have gone through these programs, even though they've had high risk factors, they have less falls than somebody who hasn't done it. So here's the first one, the Otago exercise program. And this was one of the things that's available on that Living Well website. It is done one-to-one with a trained therapist, and it's delivered as part of a complete OT-PT program. So again, this is reimbursed by insurances. Sometimes it could be small groups, sometimes it could be one-on-one. It includes exercises and walking. It's particularly designed for you. It's very specific. So let's say I had a husband, wife, couple who were taking this program, and actually because the wife was able to walk a little bit more and a little bit faster, we designed hers just a little bit differently, and it was very interesting how they were a little bit competitive about it. If you or your physician feels you should start with occupational physical therapy, this is a great kind of like first steps to it. They are looking, and I think they've made some gains on trying to get this online. For those of you, well, look at this, what a great number for a Zoom call, but some of these might be able to be taken through telehealth. Another one is called Matter of Balance, and this is a little bit more structured. It includes 8 weekly 2-hour sessions. It has peer discussion, so you have somebody about your age who kind of went through, they have discussion, they have exercise, they have education, they have some behavior modification things. I have heard wonderful things about this. I know that they're looking at possibly calling it something a little bit different, but again, I have heard wonderful things from my patients about this. This is particularly good for people who are fearful of falling. Remember how we talked about fear of falling increases the risk for falling? So this is particularly good for that. This is for the person who had a bad fall, but they didn't break anything and they really want to address one of their risk factors. The nice thing about this is that it can be done either in sitting or in supported standing, so you don't have to stand. And it's a great start for stepping on, and this is done through the mainhealth.org, but I think that Utah is also looking at doing something similar to this. And we have access to Maine's website. One of the most well-known programs is called Stepping On. This is a 7-week 2-hour classes. Again, you have peer discussion, you have exercise, you have expert lectures, like you would have the pharmacist come in, you would have me come in, maybe a PT. It's a great follow-up to Otago. This particularly focuses on standing exercises, and it's you can hold on to a chair, but it's primarily in standing. So if somebody it's very weak and everything, we always say try to start with something a little bit easier. If you're not feeling safe standing and walking independently, this is not the program for you. If you're one of those people that's taking the dog out for a walk and you're doing great, this will challenge you. And again, this is something that's offered, and it's on that website that I showed you earlier on. Another fantastic program is the Tai Chi. It's both for fitness and for balance. And I think that the one that we have here in on the website is particularly for arthritis as well. This doesn't have an educational component. This is just about, going in and doing the exercises. Classes, you don't have to start or end, it just kind of goes. The instructors will often let beginners or let beginners know, hey, this is how you can address it for this. You can make like different modifications for it. This requires a little bit better balance. I've seen people that if you're able to stand, you can do it. I know that I put that in because it's part of their program. It says that you should be able to stand on one leg for 3 to 5 seconds. I went with my dad, and I've seen clients there that weren't doing that, and they had a good time. And it's fun. It's actually lots of fun. I enjoyed it. All right, let's see. So how do you find them? Sometimes the greatest challenge is actually how to find some programs. And I've put up some things here. The Utah Fall Alliance, the Living Well website, the Area Agency on Aging. You can get those, the hospitals and the clinics, they have it on their website that they offer it. They have these at the YMCA. Like I said, some of the senior centers have either this, or they can give you information how to get into it. So remember, the more you move, the better it is. The bottom line is your body will be stronger if you move. You have a decreased risk of falls if you're able to do some of those things. It's important to find something that you enjoy, because if you enjoy it, you'll be able to do it. If you're consistent with it, again, it's one of those circles, like it gets you stronger. Whereas if you don't do it enough, or if you do it inconsistently, you will get weaker. You will maybe decrease your social participation. And again, a couple more resources at the Living Well website. And when you can either go up there, up on the left upper corner, finding a workshop, exploring a workshop, you can schedule, you can find out if they're next to you or what area you're in. You can either give it the number. And now I was going to just thank you. I have some more resources, but I was going to leave it up for some questions.
If you all have questions, you can unmute yourself and ask. I
Yes.
see Vicky.
So one of your early slides, you wrote down that there was 50 hours per 6 months of exercise for balance. And that only translates out to 1 hour a week. So are you talking very specifically about doing like a standing balance exercise program like Tai Chi 1 hour a week? Or is there something, that part had me confused.
Oh, I see. This is, let me go to the slide. Hold on.
It was one of your very first ones.
Right. I
And you
see it.
said you were going to
50
talk
hours
more
every 6
about it,
months.
so I didn't
Right.
ask, I didn't interrupt.
Right. Here. No, you're absolutely right. So the slide said exercise to improve your balance and strength. It takes 50 hours every 6 months to improve balance. So they looked at how quickly we lose our balance, and how much does it take for us to go back to midline. So it's 50 hours every 6 months. If you were to do 2 hours a week, 2 hours a week, then you would be, I mean, that's what we wish that people would do. Even that translates into 30 minutes a day for 4 times a week in order to improve it. But this is for somebody who has had bad balance, or somebody who has had falls. This is not for somebody who's like in pretty good shape and you just want to maintain your balance.
Oh,
So is your question more about just how long do I need to do 50 hours every 6 months in order for me not to ever fall? Is that your question?
no, because there's ice out there. I know that. So I guess part of the issue is that right now, I'm involved in the enhanced fitness program, but
Okay.
that from week to week, I would never really timed it, but my guess is that we have less than 30 minutes a week in that. And then I also do yoga, but my yoga also involves a lot of floor work. And I don't see floor work as, so I don't do Tai Chi. And I'm thinking maybe I need to add that to what I'm currently doing. I mean, I walk, but I don't see that as balance exercise.
No, walking is balance exercise. I promise you. If you walk if you don't do anything else but walk 30 minutes, 4 times a week, in a month, your balance will be better. There's tests that we do, and we test people, and if they consistently do that, walking is probably one of the best things that you can do on your own if you're walking in a safe area. But you did say, I want to address something, because a lot of people these days are doing yoga, and this came up from one of my father's best friends saying, oh, but I'm not working on my balance because I'm doing yoga. Oh my gosh, yoga is all about core and about breathing, about your body's awareness. That you are doing amazing. I wish I want to make time in my life to do more yoga because it's so beneficial. We're looking now at yoga being able to address things that, OTs and PTs have been working with back patients, that yoga is almost as efficient as surgery or something like that. So yoga is wonderful. Please doing that. Oh, I see somebody else. I see another.
Yeah, so the way to do that, the way to add yoga, retire. It works wonders.
I'm trying. I'm getting there. Thank you. Thank you for your question. Paige, did I see you raise your hand?
No, I got the flu shot today, so my arm's getting sore.
Oh,
I'm just moving it around.
Out there. Oh, good. Anybody else? Or I know that a lot of people have very particular questions about home modifications. How can I do this? And it matters so much on the home, on the situation, who's around. I mean, just even having a pet just changes everything. So this is why it's very difficult to give generalizations about home modifications. But if I could say anything, make sure things are lit, get some grab bars. Next time when you have to redo your bathroom, get a taller toilet. So I know that this is something that people have been asking, but I'd be glad to answer anything else or any questions that you all might have. Or we can finish early and I can give you back all your time, except it's so very hot outside. I was going to say, let's all go for a walk.
Well, thank you. Unless there's any other questions, y'all can interrupt me. Thank you so much, Dr. Mueller-Planitz. I really appreciate it. Really great information. Y'all caught that last slide that she had up there, right? About move your body, move your body. I did not plan that. I had nothing to do with that slide. I talk about that all the time. That's my mantra. Move more. And also, Vicki, all of the cardio that you do in enhanced fitness is balance training.
Exactly.
Side to side, hamstring curl, alternate your knees, marching in place, all of that counts as balance training. But we also do the single leg stance, the tandem walk, the tiptoes. That's in addition to. So Dr. Mueller-Planitz's comment about walking, moving is balance practice, right? Moving our bodies. So you can count, you're getting in a good amount of balance practice with those 3 days a week at Enhanced Fitness. And just to tag on to the presentation and the wonderful evidence-based classes that were highlighted, thank you for that. Salt Lake County offers wonderful falls prevention classes. And guess what? Next Tuesday, Melanie Brandt, who's on the call, one of our health educators, and Erica Thompson, who many of you know, are going to be doing a presentation on that specific topic. what does Salt Lake County Aging and Adult Services Health Promotion, super awesome team, what do they offer for falls prevention? So please, if you're interested in those evidence-based programs, please come back next Tuesday at 2:00 to learn more about those as well.
I'd like to come back because that sounds interesting for me, and I'd like to update my resources. I think Marianne had mentioned, so that's why I didn't address that. But again, we have amazing resources, and the Fall Prevention Alliance, we're working with legislators to get things covered so that all of us and all our loved ones can remain in their homes, because preventing falls or falls are the number one reason that people do not live in their homes and they have to go to a nursing home or live with families. So this is something that I feel very passionate about. Thank you for that, Paige, and I think I'm going to join you next week.
I will include you in. I put down a note here. And also, I appreciate the broader view because I know I get very focused on Salt Lake County. And to your point, there's people who have loved ones outside of Salt Lake County and need to know more national ways. That's why I really appreciated what you presented was there are other programs besides what we offer. And in a different area, they might offer different programs. So to be aware of those is great. So I will definitely send you that link. And everybody else, it's the same link, same time, actually. It is the same link next Tuesday at 2. Always the same link, same time. And really appreciate everybody being here for this presentation today. And hopefully we'll see you next Tuesday for more falls prevention themed webinars.
Thank you, Paige, and thank you, everybody.
Thank you. Have a great day, everybody. Thanks. And Healthy Lifestyles, your link is in the chat. If you don't have it already, I'll put it in one more time.